I wanted to do a simple blog and some video information on some very common conditions we see in the clinic. Now, the reason I'm talking about both of these conditions is they're both quite similar, they just affect different areas of the body. Now, I'm talking about Osgood Schlatters and Severes. Now, the scary thing about Osgood Schlatters and Severes is they have names, they're hard to pronounce, and they've got the word disease at the end of them. These particular conditions are nothing to be too concerned about, and it's something that will resolve with age and time. Now, I've put in a little bit more information in the blog on what this means for your child if you're trying to help them through this and how physio can help. I've also put up a couple of exercises that you can try and things that I've seen in the clinic help kids keep going with their sport and improve their symptoms. Now, to sum up what Osgood Schlatters and Severes is it's a combination of some genetic components that leads the child to getting the condition in the first place. So sometimes it's quite common if you've had this condition, maybe your child's going to have it, and so on and so forth. This isn't a bad thing, it just means that there's a bit of a genetic predisposition to getting this condition. The second thing is growth. So the symptoms usually worsen when a large period of a growth spurt happens. So really important to start charting your kid's height and keeping track of it. Activity level and body weight and strength can also be contributing factors that need to be looked into. Now, the great thing about the research that looks at these conditions is that physiotherapy can help. Now, it doesn't help in the traditional sense of curing the condition or making it better or go away, as these conditions will not completely resolve until the child is finished growing. So until they're around the ages of 18 to 20, they might have some remnants or some symptoms at some degree. Where physio has been shown to be really helpful is minimizing the impact that these conditions have on their sport and activity and their function. So previously, we've probably all met some kid or know some kid in our past that has had to pull out of sport and stop playing sport because of growing pains. Now, these particular growing pains, if they're getting them around the knee or around the heel, they probably had Severes or Osgood Schlatters and they didn't have someone in their corner to really help them out. So I treat this condition quite a lot, and the thing that seems to help the most is reducing the child's activity level to a point where they're still being active and still doing the things that they want to do, but they're not doing too much. Secondly, we get them really strong, so really focus on the quad and leg strength and the strength around the calf and the heel. We look into their jumping and landing and running mechanics to try and take some load away from the patellar tendon and the Achilles tendon, which are the structures that get really sore and irritated. And we give it enough time. Those are the other things. So once you put all these things in place, it can be something that's very easily managed at home with a little bit of help and guidance from a physio. So please watch the following videos, read the information, and if you've got any other questions, reach out.